When it comes to checking your blood pressure, you've got two main choices: manual and digital blood pressure monitors. But which one is better? Which one is more accurate? And more importantly, which one should you rely on for tracking something as vital as your heart health? In this video, we're diving deep into the key differences between manual and digital blood pressure monitors. We'll look at how they work, their pros and cons, and what you should consider before buying or using either one. Whether you're a healthcare professional, a caregiver, or just someone keeping an eye on your numbers at home, this is a conversation you won't want to miss. Let's explore, right here, on History of Simple Things. Let's start with the manual blood pressure monitor, often referred to as a sphygmomanometer. It's been the gold standard for decades in hospitals and clinics. The manual method involves a cuff, a rubber bulb for inflating it, a pressure gauge, and a stethoscope. The process is quite hands-on and requires some training. To get a reading, the cuff is wrapped around the patient's upper arm and inflated until it cuts off blood flow. Then, using the stethoscope, the practitioner listens to the Korotkov sounds, the whooshing or tapping sounds that indicate systolic and diastolic pressure while slowly releasing the air. This process demands good hearing, proper technique, and a calm environment. It's not something everyone can do without practice. So why has this method been trusted for so long? The answer is accuracy. Manual blood pressure readings, when done correctly, are generally more accurate and less prone to misinterpretation caused by technology. They don't rely on batteries or electronic components, making them more reliable in low-resource settings or during power outages. This is why many doctors still prefer manual monitors in clinical settings. They also allow a trained professional to detect irregular heart rhythms and other subtle variations in blood flow that a digital monitor might miss. However, the catch here is the phrase, "when done correctly." Manual readings are highly dependent on the skill of the person using the device. Any small mistake, like placing the cuff incorrectly or mishearing the sounds, can throw off the result. That's a major limitation for anyone trying to check their blood pressure at home without medical training. Now let's move on to the digital blood pressure monitor, which has become increasingly popular for home use. These devices are all about convenience. You wrap the cuff around your upper arm or wrist, depending on the model, press a button, and let the machine do the work. It automatically inflates the cuff, detects your pulse, and displays your systolic and diastolic pressures along with your heart rate on a screen. No stethoscope, no listening for faint sounds, no guesswork. For most people, especially the elderly or those managing chronic conditions, digital monitors are a game changer. They make it easy to check your blood pressure daily, track trends over time, and even share results with your doctor through connected apps. But are digital monitors accurate? The answer is, it depends. High-quality digital monitors that are clinically validated and used properly can provide results that are close to those from manual methods. However, cheaper or poorly calibrated devices may give inconsistent readings. Wrist monitors, in particular, are more prone to error because the arteries at the wrist are smaller and closer to the skin. Positioning your wrist at heart level is also more challenging than it seems, and any deviation can affect the accuracy. Arm cuff digital monitors tend to be more reliable, especially those approved by medical authorities like the American Heart Association or the British Hypertension Society. Another important factor to consider is the user. Not everyone has the eyesight, hand strength, or training to use a manual monitor effectively. For these individuals, a digital monitor is often the only practical choice. It's also less intimidating. You don't have to fumble with a stethoscope or worry about the exact inflation level. Plus, digital monitors often come with memory storage, alerts for irregular heartbeats, and averaging functions that can improve the reliability of your results over time. That said, digital monitors can malfunction, especially if not maintained or calibrated periodically. They may also give false readings if the cuff size is wrong, if you move during measurement, or if the device isn't positioned correctly. So, while they are user-friendly, they are not completely foolproof. One major difference that often gets overlooked is cost. Manual blood pressure monitors are generally cheaper than their digital counterparts. A basic aneroid sphygmomanometer and stethoscope combo can cost less than $30. Digital monitors, especially those with smart features, can range anywhere from $50 to over $100. However, when factoring in ease of use and potential health benefits from regular, stress-free monitoring, many consider the investment in a good digital monitor to be well worth it. So which one should you choose? The answer depends on your needs, environment, and comfort level. If you're a trained medical professional or someone who values pinpoint accuracy and has the skills to use a manual monitor, that might be your best option. But if you're managing high blood pressure at home, have limited medical knowledge, or just want a fast and simple way to check your numbers every day, a digital monitor is likely the better fit. In fact, for many people, using both can be a smart strategy. Rely on your digital monitor for daily checks, and then confirm accuracy with a manual reading at your next doctor's appointment. At the end of the day, it's not just about choosing manual or digital. It's about being consistent, using your device correctly, and keeping your healthcare provider in the loop. No monitor is perfect, but both types can be powerful tools in staying ahead of hypertension, heart disease, and other cardiovascular conditions. The most important thing is to monitor regularly, stay informed, and act early when something's off. So there you have it, manual versus digital blood pressure monitors, each with their strengths and weaknesses. Thank you for watching. If you have suggestions for our next video, feel free to share them in the comments below. We'll be sure to give you an acknowledgement for your contribution. Thank you for joining us on this journey through the history of simple things. Don't forget to like, subscribe, and stay tuned for more stories woven through the smallest details.